Hi, this is Meg. Welcome to Spit It Out. This is where we cut the fluff and spill life's real truths. Today, I have Jack or ToothDocJack here. So I'll give him a really warm welcome and we're going to get started and kind of ask him some fun questions today. Welcome in, Jack. Good morning.
Hey Meg, good morning. How's it going?
So good. It's lovely. It's getting chilly over here. The leaves are falling. So could you begin by sharing your story and what inspired you to pursue a career in dentistry?
Yeah, so I grew up in Utah. I'm the oldest of four kids. My dad's a general dentist, actually. And growing up, I'd always be the one responsible to go help him on the weekends when people had emergency cases. Didn't happen too often, but there were definitely weekends where I'd go help him take out a tooth or just do some emergency care. And so that kind of got me initially like exposed to dentistry. Later, I went on a 2-year mission to Guatemala. So I lived in Guatemala for 2 years and I just saw a lot of people really suffering that had a lot of teeth problems, right? And I kind of connected the dots between, hey, my dad does this. I'm seeing this every single day, all these tooth problems. And so that's something that I really want to pursue. And so when I got home, I went back to school and I was pretty much dead set on going into dentistry from the beginning. So yeah.
Where did you go to undergrad and where did you go to dental school?
I went to BYU for undergrad and then I went to the University of North Carolina. So that's a big difference, right?
Wow, that's so
Very
cool.
different. But I really came to love North Carolina. Like it's a really great state. I love the University of North Carolina. I think it's a great dental school. But I think there's things that every dental school could definitely improve. A lot of room for improvement.
What was your experience applying to this dental school and maybe other dental schools in comparison?
Yeah, so I applied to how many? I think it was like 8 to 10 dental schools all over the place. So Columbia and obviously my state school, which is the University of Utah. The application process itself is pretty similar, right? Like there's this one application that you fill out and send to every school. And then every school has these different like secondary applications. So other essays that you have to do. And at the end of the day, they're all pretty similar. But uh, mostly they just want a little bit more information about like why that specific school, but I would say overall they're pretty similar to apply to.
What year did you start applying to dental school?
So I started applying in 2019 and then
Okay.
something fun happened in 2020, right? So my dental school experience.
Oh, yeah. Oh my gosh. So
Yeah,
you were that class that went
I
in
was
like feet first.
exactly. I got to start in it was like June or July of 2020.
Well, tell me a little bit about that because I haven't really chatted with many, honestly, dental students just in general who went through that. It's a very one group of you guys. So tell me a little bit about like what was different when you got in, what versus what you were expecting and the stresses that came with it. Obviously, it was not what you were expecting.
Yeah, it was, I mean, so different. At the time I was married and we moved across the country in, when was that? April of 2020, which was obviously a bad time. And so got to North Carolina, everything was shut down. And the place where we were living was very much, it was just super strict, right? And when dental school started, we didn't even go to campus really, right? So everything started on Zoom. We would go very occasionally to like an anatomy lab or a dental anatomy lab, but it was so different and there's just a lot of fear, right? And my like our for example, with our dean, we hopped on a Zoom call with everybody and he's like, "Yeah, like hate to break it to you guys, but there's a really high chance that you become a 5-year program instead of a 4-year program." And we're like, are you going to pay for that 5th year?"
Yeah, I was gonna say no, thank
Like,
you.
we're not gonna do that. So it was a lot of fear. There was a lot of confusion. It was pretty scary, honestly. Like I genuinely felt scared about the future. And obviously, at the time, people just didn't know everything, right? Like there was a lot of people dying and there was a lot of just confusion. There was no vaccine or anything yet. So it was a scary time. But we got through it, right? And it mostly affected our didactic stuff. So like our classes is what you do for the first 2 years of dental school, and so all of that definitely got affected that first year, but then after that, like, I was fortunate to be able to get back into clinic and be relatively unscathed.
I'm really glad that we got through it. I feel like I learned a lot from infection control that was peaked. I think I still do stuff from those days because it was so tied down, which I thought was actually probably a good idea because nowadays I've learned that, like, oh, we didn't used to do this before COVID. And I was like, really? What? Like, that's weird. Anyway, with the rising costs of dental school, what are your thoughts on how this impacts students and the future of the profession?
Yeah, I think most people don't understand that dental school is the most expensive professional program in the whole United States, right? More than med school, more than law school. A lot of dental schools, like for example, if you're paying full cost of attendance and living, if you're going to one of the expensive schools like NYU or USC, you're looking at 500, 600, 700, $800,000. That's a lot of money, right? That's a lot
Yeah.
of money.
Yeah.
And the costs have just dramatically skyrocketed, and inflation has skyrocketed as well. And salaries really haven't changed that much. Like a new grad dentist will make, you know, it will not make, it's not like you're graduating and making $500,000, right? It's more like 160, 170, somewhere around there. So it's not as much as people think. And that's not like complaining in any way, right? But it's just kind of being honest with what's going on. And I think that that dramatically influences people's ability to start families. I think it harms people being able to buy a practice. So I've noticed that a lot of my peers, I'm in residency right now, but a lot of my peers kind of just go like a corporate route because they'll hire anybody basically, and you can get a lot of experience and do a little bit better financially, but they're really working you to the bone, right? Just to try and escape those student loans. That's what everybody's trying to do. I think it's worth noting that with the recent like bill that got passed, the big beautiful bill or whatever, that there's a new cap on student loans. So max federal loans that you can take out is $200,000 from what I
Yeah.
understand.
Something like that.
So I think that that's going to cause a lot of big changes in people's ability to like go to dental school.
Absolutely. I mean, I took out private loans only. I, one, wasn't educated on federal loans back then. No one really told me, but I'm just
Yeah.
glad that I really didn't take out a whole lot because I was going to hygiene school, but I always thought about the people who were taking out 10 times as much as I was, going, holy cow, there's no way out of these. They will get you no matter what. They don't care what you're making after school. They don't care about anything. And I'm like, just horrible.
Can
Predatory, in
I
my
ask
opinion.
because I'm curious, like what private rates, like what interest rate did they give
Oh,
you?
so let's see. I took out two loans for 2 years of hygiene school, and my first loan was 7% interest, and that was in 2021. And my second loan was 7.8% interest, and that was 2022. And I was like, oh, so the highest you guys would do would be like 12. And that was back in the day. But now I think it's up to like probably 12 to 14. But like, if your credit's really good, I'm sure you could still get like an 8% loan. But I mean, I only took out 37,000. So like, very doable for a hygiene salary because, I got out of school making, I'm going to say like, I think it was like 70 to 75,000. So
Yeah,
like, honestly,
that's good.
it makes sense. Like I was able to pay them off in 2 years. But that's the thing is like, I went to a state school and then there's private schools in my state too. So I don't know. I feel like it's similar with dental school though, right? You could go to a private versus dental. Tell me a little bit. Maybe I'm uneducated on it though.
Yeah, no, there is definitely a big difference. No matter where you go to dental school, you're going to get the same degree and more or less the same experience. I will say that there are some schools that like Midwestern in Arizona, for example, where they really like give you a really good clinical experience. You're doing a lot more than a lot of other schools, but for the most part they're all pretty similar, right, as far as like what type of education you're getting. The difference is cost, right? So obviously the cheaper schools, the state schools, are a lot more competitive. The University of Utah, for example, for me, like it was just hyper competitive, and Utah itself has a lot of dentists. So, and Idaho too. But so that was a really competitive school. I didn't get in, even though I had the grades and stuff to get into like Columbia University and even like the University of North Carolina. But those places just cost a lot more. I remember interviewing at Columbia, it was cool to be there, right? Like, I mean, it was mostly applying there was like, hey, like New York, that'd be cool, and Ivy League or whatever. That quickly faded when I like started talking numbers and stuff, and I was like looking at the sheet. I'm like, how do you guys pay for this? And I remember like looking around the room, and some of the students were like, what? Like, I don't know, this. But I later kind of dug a little bit deeper, and a lot of the not everybody, right? But like there was a lot of parent help. So that's
Mm,
something behind the
yeah.
scenes that a lot of people don't see. Is that whether, that's not everybody, right? But a lot of people maybe are getting help from other sources. So that's why it's so critical to really evaluate, does this make sense for me? Right? Like if you are a trust fund kid and you have all this money coming in, then does $600,000 for dental school matter? No, like it doesn't, right? But the vast majority of people, it does really matter. And I would say to look for the cheapest school that you can get into. For me, that was UNC, right? Because I got in state tuition after my first year. But for everybody, it's a little bit different, right?
Did you take out any scholarships for dental school, or do you recommend any scholarships for dental students around?
It's tough. Like for undergrad, I had full scholarship all through undergrad just from academic, right? That helped a ton. I'm like, sweet, I
Yay.
graduated.
That's
I
awesome.
got I got out of undergrad with no debt, which is cool, right?
That's great.
It is great. But it's not great that dental school costs so much money.
Well, yeah, that's fair.
But no, I was extremely grateful for that. And so that was a huge benefit to me. But dental school, scholarships from the school itself are very rare. They would give me every year, like at UNC, there was an endowment fund, and I was fortunate too to get like little scholarships here or there, right? I mean, I say little, but like $5,000 or a few $1,000s, like that's nice, right? But
Yeah.
when it costs $400,000 or like helps, but it's not what you need. So there are different scholarships. There's military. I almost joined the military. I got this close to signing. Yeah,
Yeah, it's an
I mean,
option. It's an option.
I think like if there was zero family help, you were 100% like, I'm going to do dentistry, and your spouse or your significant other like was on board with it, then I think it's a good option. It takes a lot of your life, right? Like you do dental school, and then for the most part, there's a little bit of nuance here, but most military dentists will do like a 1 year AEGD, like an advanced education. That doesn't count towards your payback. And then you do 4 years after that. So it's basically like
Yeah.
5 years after dental school.
Yeah. That
So
makes
that's
sense.
that was my sticking point, right? But that's an option. There's like National Health Scholars Program. There's a few different things. Yeah.
So I was wondering, like, yeah, can you get that scholarship where you work in a rural area for a few years? Is that a thing?
That is a thing.
Okay.
From what I understand, it's hyper competitive, like more so even than the military, just because, yeah, like there's a lot of areas that count as being rural, right? Like I'm sure there's parts of like Idaho or like Pocatello or whatever, right, that are definitely like considered rural. And if that's where you're from and you know that you're going back there anyway, then it's like, from what I understand, you practice in a like underserved area for
Mm-hmm.
a time, and then they help with making your loans get paid back. So I would highly recommend considering that, maybe even over the military.
Honestly, try it. Why not?
Try it, see if
Yeah.
you get it.
Yeah. What influenced your decision to pursue pediatric dentistry after being a general dentist for a year, is what you said, I think?
Yeah.
Yeah.
Yeah. So, my story, time to get real, right? Like my story is very different from most people's stories. And I've had a lot of really hard things happen in my life. It's a very long story, but, I was married in college and we moved to North Carolina. And very long story short, my wife very unexpectedly passed away in December of 2023. And that was before my last semester of dental school. And it was just, I mean, as you can imagine, just absolute hell. I mean, it was just,
Yeah.
um, th- just a nightmare to try and get through and try to and recover from. Um, you don't really recover from it, but like trying to figure out how do you move forward after that. Um, and so I, at the time, was applying to these different like GPR programs, like 1 year programs in a hospital. And I was considering a few different routes. After that happened, I pulled out of everything and I kind of just wanted to give up, honestly. I was just like, I don't really care. And I guess I was just really depressed. Um, but I mulled it over. I try to think like, what do I do now? I hadn't really ever planned on working like at my dad's office. I know a lot of people view that as like, oh, your dad's a dentist, like he'll just help you out with everything. We have a really good relationship, but his practice just it wasn't really made for taking on like a new grad like me. It was very much like built around him. But we both decided like, hey, I need that time to be with family to try and like recover a little bit just because of how bad of a state of mind I was in. And so we worked together for a year. From the get go, like from starting, I realized, this just isn't going to work. Like, it's just not going to work. Like,
Yeah.
maybe if I had stayed there for 10 or 20 years, maybe someday I would be able to like take over. But I knew that I wanted to do my own thing. And I knew that like specializing was something really important to me. Um, and my wife too, like she wanted that for me as well. And so I decided just like F it, I'm gonna go back and try, even though like I know that now I'm not doing well. I'm gonna throw out applications and see how things go. And so I applied um, to peds pretty close to when the deadline was coming up. I rallied a lot of people behind me and forced myself to just get it all out there. And I'm so glad that I did because residency really has been like life changing for me. It's dramatically changed how I practice as a dentist. And I've really enjoyed treating kids and helping their families and helping these kids get on a good life trajectory as far as their teeth and like their overall health.
Well, thank you so much for sharing that. That's really impactful. And I think it's beautiful that you turned this tragedy into something empowering and just beneficial for you because I'm sure that's just not easy to do. So thank you for sharing that. What changes to residency would you do if you could change anything in general? I know you mentioned how you love it, but is there anything maybe could be tweaked a little?
That maybe could be tweaked. I think I'm going to flip the question a little bit. I'll talk
Yeah.
about dental school and then I'll talk a little bit about residency.
Yeah.
Because I
Let's
think
do it.
that it's interesting that in the past, it was kind of viewed as residency maybe wasn't totally necessary. You know what I mean? And that's because, frankly, people just got a lot more clinical experience. So, like my dad, when he was in dental school, he said he graduated, he had done like 50 crowns, like 12 something root canals, a whole bunch, like just a lot more clinical procedures. Whereas, like when I graduated, they were graduating people that had done like maybe 12 crowns, maybe like two root canals, and this isn't just this is across the board. The clinical standards have dropped dramatically to the point where, I just don't feel like there's a lot of really good clinical education in a lot of dental schools, to the point where it could be. And so I think that increasing that would maybe make it so that like a residency doesn't feel more necessary than for me at least it felt. And that could be, I mean, a big part of that is my last semester of school is just kind of a wash, but I think that that's something as far as dental schools that could be a big benefit, right? And then as far as residency goes, I don't really know. I got so fortunate. I feel so lucky to be where I'm at. Like I genuinely feel so supported and so cared about. There's always little like red tape things, right? No matter what school or hospital or wherever you're at. My big tip and suggestion for anybody listening is to just thoroughly vet whatever residency, whether it's peds or oral surgery or wherever you're going, like thoroughly vet the programs and, or like rank and choose the places that actually feel like they'll like kind of vibe with your life, right? Or you'll fit in. Because if not, you're just going to be miserable. And it's a big chunk of your life, right? Like you don't want to be miserable. There's always hard days, but like you want to be somewhere where you feel supported. So
I genuinely don't know a whole lot about peds residency. So, just to break it down, honestly, for me and the audience, when you go to the hospital, other than the emergency where you're talking about a trauma or maybe a tooth is hurting, what else do you do? Like, what do you love to do in the hospital?
we sit in the back, we twiddle our thumbs, we just no. It's honestly, it depends like what for peds at least, there's a few different types of programs. So there's school-based, like University of North Carolina has a peds program.
Okay.
There's hybrid programs where you're at the school and then it also ties into a hospital. And then there's like purely hospital-based programs. So my program is like purely hospital-based. We mostly treat people on Medicaid. Every week varies, but like a typical week is like, okay, on Monday, I have a clinical day. So I might have a class that morning from like 7 to 8. And then from 8 until like 5, I'm treating patients all day. So I'll have a column of like maybe 8 to 10 kids. And then on the side, there'll be little exams. So like there'll be a hygienist that'll come in or an assistant and be like, hey, I need a hygiene check or I need an exam as well. So it kind of varies how many people you're seeing, but you're doing a lot of treatment, right? So like you'll have either a 45-minute or an hour block to do treatment, whether it's a lot of stainless steel crowns, it's composites, it's pulpotomies. Pediatric dentistry, like the procedures that you do are pretty limited and they're pretty, I don't want to say simple, but it's pretty straightforward, right? It's not like you're doing root canals all day, but you have to get really fast at them because kids just crash out so easy, right? Even with the nitrous, like they just, so that's like a typical clinic day. But then on top of that, we'll have like an ortho day where I'm working with an orthodontist and I'm just seeing a column of ortho patients. And then the next day I might have an OR day. So we literally go to the operating room, we work with anesthesiologists, they put the kid to sleep, and we'll do like 20 crowns, right? So like a ton of dental work under anesthesia. So it does definitely vary, but these are all things I didn't even fully realize before PEDS residency, right? Like I didn't realize how comprehensive it is, but we really are covering a lot of general treatment, growth and development, and more advanced procedures like in the OR.
How do you think dental education programs can better prepare students to work collaboratively with hygienists?
That's such a good question because even though I started back at my dad's office, it was kind of hard to learn how to integrate with the hygienist, right? Because I think that there should be better collaboration where sometimes it can be easy, maybe as a hygienist, to kind of, I don't know, I don't want to say like isolate yourself, but you think like, hey, I've got my lane, I'm going to stick to it. And the dentist is like, well, I'm just going to do my thing and then I'll just do these hygiene checks. But I know that, like, for example, like maybe older docs don't view periodontal disease as that important, right? Whereas a lot of like hygienists and especially like newer hygienists realize how critical it is to actually diagnose and treat that. So I think that there needs to be better communication from dentists and hygienists and have things feel more like a more teamwork. You know what I mean? I don't know if you
Yeah,
felt that. Do you feel like you get that you're working as a team all the time, or does it feel more of like, hey, I'm kind of doing my thing and they do their thing?
it's been different with all of the dentists that I've worked with the last two
Yeah.
and a half years. But the dentist I work with now really respects the knowledge that I have gained in the last 2.5 years. And just, I think he really loves how passionate I am about perio. He's not much of a talker, but like, I'm pretty sure I get that vibe because I'll tell him, I'll give him my dental hygiene diagnosis because in Idaho, that's a thing actually. And I'm like, hey, this is what I think we need to do. And most of the time he just goes, yeah, looks good. Yep, I agree. Let's do it. And I'm like, okay. And it's not like I'm diagnosing, but I really do think he gives me more autonomy, as in like our brains are like connected, and I'm like, he's like, I'm on your vibe. I get what you're saying. But I have worked with dentists that like don't diagnose perio at all. The podcast I'm about to post will kind of go into depth a little bit about this, but I worked with the dentist. I was temping one time and I was like, hey, so where's your perio sheets? Like, where can I find all your ortho? He goes, yeah, I don't do perio, straight up. And I was like, what?
Like, what do you
Literally,
mean you
like,
don't
what
do
are you
Barry?
talking about? Like, I literally said, respectfully, why? Like, you mean?
That's
And
crazy.
he literally just was like, you know what? They just pull out teeth anyway, so I just figure I could do it. So I've never worked with a dentist as neglectful as that one since, which is really good. He ended up leaving the DSO we were working at, but I will never forget that ever. And the last few years of changing offices and temping, I've really learned to be like, no, I need to work with a dentist who trusts me, because if you can't trust me, we're not going to work well together, because this is all I do all day. This is all I do, and you do the fillings all day and the extractions and all this stuff. So I'm going to trust you on that, but we got to work together. And so it's just so important to work with a dentist that trusts you and you trust your hygienist, because it's so much easier too during exams. Like, I don't know
Yeah.
if you've ever worked with a hygienist who doesn't really say anything. Like, you walk
Yeah.
in and they go, this is Sue. And you go, great. What's going on? you
Yeah.
know?
No.
I could
Yeah.
imagine that could be stressful for you, because you're like, wait, okay, what are they here for? What did we do on them last? I don't know who this person is. I've learned to literally just word vomit everything. And all he does, he comes in, he diagnoses cavities, he agrees with me or disagrees with anything. And then that's it. It takes like maybe 5 minutes max. And then he's gone. And it's just so much easier for everybody. And I just feel like it should be like that with everybody. Hopefully we'll get there one day.
No, I totally agree. A good hygienist makes your life just so much easier, right? Like as a
Yeah.
dentist, because as a dentist, you're juggling a lot of stuff. You're going from op to op and you're worrying about all these other things. And so I can see how you could feel like, oh, like it's just a hygiene check. Like I don't care, you know? I could see how you could feel that way. But like having a great hygienist who like gives you the information is like and is like actively trying to help you
Hmm.
out just makes life so much easier, right? And also like being able or being willing to hop in and sometimes like hop in and do a IAN block, right? Or like go give a little bit of local anesthetic. That's also something I think that really helps. As dentists, what do you think dentists could do to help the hygienist, right? Does that make
Man.
sense?
Yeah. I mean, that's a great question. I feel like we could do a whole episode on that. I think there's a lot of things, but like I said earlier, just trusting your hygienist and hiring a really good one that's passionate about what you're passionate about. Because if you hire someone who's not going to diagnose perio and who's not going to do the SRP, who's not going to do like a gingivitis scaling, which is like not like an insurance is going to pay much more, but it's just putting that out there and going, no, this is what you have. We are literally going to sit down and talk about it for a second. It adds so much to a practice. And I feel like if dentists prioritized that more in general, we would have more hygienists who cared more about it, because I do think sometimes even older dentists and older hygienists can get kind of in a rut. And I've seen it before. And it's kind of like my worst fear of like getting into that rut. And so I would never want to kind of work with a dentist that just does nothing. I've worked with a lot of dentists that do a lot of things, but my favorite dentist that I've ever worked with taught me a lot during her exams because I would just sit there and listen and I would just absorb everything from all of the CE courses that she took. I knew she was just putting it out on the table for the patient to eat. And I was
Yeah.
right there like, oh, this is so cool. And I just think the best thing that a dentist could do, in my opinion, is other than trusting your hygienist, is doing CE courses that are nuanced and fun and new and talking to your patients and your staff about like what's going on in the world. Because some of the things in the dental world I don't really need to do, but it's really
Yeah.
cool when a dentist, they take what they need to know and they can just throw everything else out to the team and be like, hey guys, this is really cool. And you can just tell how passionate they are. I just love a passionate dentist. That's my favorite dentist to work for. It just gets my little like tinglies going because I'm like, oh,
The ding.
I'm so passionate. You know what I mean? I don't know if you feel the same way,
No,
but
and I
like,
can tell.
I
Yeah, I
think
can
it's the
totally.
best. I love
I
it.
think no matter what you're doing in life, whether it's being an assistant or a hygienist or a dentist or a resident, you get one life. You know what I mean? I mean, ever since what happened to me, I've just a lot. I just have a very different perspective on life, and just it's so short, right? And so it's like you can be that mediocre, lame, everybody like can't stand them hygienist, right? Who's like, I don't care. I'm just putting in my hours. Or dentist, right? Who's just
Yeah.
like, I don't diagnose perio. I don't give a crap. Or you can be passionate about your stuff. And if you're really passionate and you care about people, they notice, right? Like they know if you're just half trying or if you really care. And if you really care, like you'll make a podcast or you'll make content or other stuff like that. You'll make more money, you'll help more people, you'll just be happier with life, right? Like you'll have a more fulfilled life. So
Yeah.
I know some hygienists who just are like, I can't stand this, my back hurts, like I'm just doing this for another few years, I'll be done. They do a lot of, and this isn't any knocking, right? I know that hygiene is such a physically demanding job, it's so difficult. Dentistry is too, right? But
Hmm.
anything, like you're bent over all
Anything.
day. But
Assisting. Everybody's like upside
Den-
down.
it's like we all need chiropractors
I
and
know.
therapy,
Yeah.
but you can be that way, or you can dive all the way in and just give it your all. And I think that you'll be a lot more satisfied with life, right?
So, as we look ahead, what excites you most about practicing pediatric dentistry to the fullest outside of residency and working with children and families?
I don't know where it'll be. I don't know when it'll be. I have a general idea, but I really want to be in practice ownership. I've already got a name down. I know that there's no like trademarks or any issues with that. It took a long time to get, and
Yeah,
it's so good. It's
that's
so good.
exciting. I'm so excited. Oh my
Yeah.
gosh.
I have like, and I've already worked with like a branding firm. They've already come back with a lot of logos and murals and stuff like that. The ball's already rolling with that. And I hope that it's as soon as possible after I graduate. Maybe I'll work for a DSO part time or I don't know
Mm-hmm.
what I'll do. And I don't know where this will be, but I've already narrowed down most locations where I would like. And that's what excites me the most, right? Like I want to run a team. I want to have a lot of autonomy with how we're treating kids. And more than anything, like I think as a pediatric dentist, you have the most effect on both kids and parents by avoiding trauma, right? So like you're trying to keep it as happy and good of an experience as possible so you don't traumatize the kids. And then two is actually just developing these habits that stay with them for life. Like they won't need SRPs in the future if they just floss their dang teeth, right? And they get in that habit as a kid versus when they're 50 years old. That brings me a lot of fulfillment because I don't really diagnose perio anymore.
Yeah.
Sorry, kids.
Hey, I don't blame you.
Six
Good.
2-year old doesn't have perio, but I can see the beginning parts of that, right? I all the time, it's pretty traumatic, honestly. I get to see a lot of cases where it's like, hey, smile, and it's an 8-year-old and they've got cavities on every
Oh,
single tooth and
gosh.
gingivitis, and it's just like
Yeah.
horrible blown out mouth.
Neglect.
It's
Like, ugh.
neglect, right? It's
Oh,
so
so
sad.
hard.
And a lot of these kids are, it's not their fault, right? But I work with them, like I'll show them chairside, like, hey, floss for me, show me how to do it. Here's a bunch of
Mm-hmm.
floss and brushing too. But we all know it's the flossing that nobody does, right? So I look forward to helping thousands and thousands of kids and families have just develop really great like oral health routines that'll just help them for the rest of their lives and hopefully save them a lot of time, a lot of money, and just have really good smiles.
I have a question, and I was wondering what is something that most parents do not know that could help their kid very quickly? And just what about your fun fact? I don't know if you have a fun
My
fact
fun
for
fact:
parents that you're like, oh my gosh, I need to tell you something.
don't give
Yes.
your kids juice. Don't give them
Woo!
juice. They don't
Don't
need
do it.
juice. Don't do it. No
Throw it
juice.
away.
Throw it away.
Throw it away.
Parents a lot of times, and granted, like I work with a different socioeconomic group than probably what most people are treating in private practice, but still parents all the time, I'm like, yeah, like you shouldn't give your kid juice. I mean, maybe it's a treat or something, but just don't do it. And they're like, what? Like I thought it was
Yeah.
natural. And I'm like, no.
Yeah.
So for the fun fact for parents is kids shouldn't really be drinking any flavored drink, right? Like just they don't need it and it destroys their teeth.
Yeah. Oh my gosh. Okay.
So
One more random question. Very curious.
let's hear it.
Do you talk to your patients about childhood sleep apnea, teeth grinding, any effects with that? Because it's very nuanced. It's just starting. So I'm curious, like, what's your experience with that?
So if you read the AAPD manual, okay, I got to be careful here because I know that this is a very hot topic. Pediatric airway is
Yes.
becoming a very big
Yes.
topic. And it's interesting. It kind of shocked me when I first started seeing it, but you'll see a lot of kids who just have really eroded teeth. They're ground
Mm-hmm.
down like crazy.
Yeah.
And it's kind of shocking when you first see it, but we just kind of leave it alone. I mean, you'll feel like you'll do some fillings if you have to or crowns, but the AAPD manual and the best evidence supports that like sleep apnea in children is caused by two things, really. It's you have really big tonsils or you have a BMI. So you're like severely
Mm,
overweight.
right.
I know that there's a lot of talk about like like functional therapy. There's like, hey, do we expand to help you breathe better? From everything that I know and from all the doctors that I've talked to, I don't know how much true evidence there is behind that. I need to do more research on my end, but
Yeah.
from most cases, it seems like I think that tonsils could be looked at a lot more in a lot of kids. So,
Yeah.
like parents, if you notice that your kids have ground down their teeth like crazy, and as long as like orthodontically everything's fine. I mean, if you had a constricted, like if your palate was like this, like if it was a super V, then, I could see there's cases for expansion and stuff. But I think the true benefit is going to be like through working with an ENT to determine like, hey, do we need to look at the tonsils first, or is your kid like super overweight? And if we check those boxes off and there's still issues, then I think that it's valid to look into those other options that are very hot right now.
Yes. Oh my gosh. We
So
should do a whole episode on like holistic dentistry because I don't talk to dentists much about like what's real, what's not, what's going on. Because it's very confusing as a hygienist because I see a lot of stuff and I'm like, I don't know what to
you want to
talk
know
to my
another
patients about.
hot topic right now?
Give me your hot take. Spit it out, Jack.
My hot take is that most people don't need like a tongue tie, right?
Yes.
Like when they're
Yes.
like
See them
lingual
all the
frenum
time.
is you see
Yep.
them all the time.
Oh, yeah.
It's become very hot topic on TikTok and Instagram that we just need to cut them, right? So like I have so many parents that are like, "Hey, my kid's tongue tied. Let's just cut their like lingual frenum."
Yeah.
And most of the time, they don't need that. Like, you shouldn't be
Mm,
doing that. It's very rare.
okay.
I've only diagnosed, and granted, like I'm still newer in residency, but I've seen a lot of kids, and I've only diagnosed one true tongue tied my whole time as a dentist, right? So stuff like that, where you need to be confident, like as a parent or as a patient, you need to be confident that you are going to dentists who really care about your overall well being, right? I'm not saying that if you do a tongue tie release that that's bad or anything, right? Just like you were saying before, you need to trust that your dentist or hygienist is passionate, that they're going to events, right?
Yeah.
Like that they are very well informed, because it can be a lot easier than you think to be a dentist or a hygienist and not be maybe as passionate as you should be, or staying up to date on like current research, right? Always take a step back. I'm more conservative with things and just want to make sure that I'm having the patient in mind, right? Like their best
Yeah.
interest.
Yeah. I see a lot of funky stuff on TikTok with kids. Now that we're talking to you, there's a lot of TikTok shop products that parents will like slather something on their kids' teeth. They're like, my kids got rid of their white spots on their front teeth. And I'm like, I think they just got crowns, babe. I think they just got some nice porcelain crowns, but
Meg,
okay.
it's the charcoal toothpaste. That's what they need, right?
No. We are just going to wrap up here a little bit. What comes next for you in your journey, and where can listeners connect with you if they'd like to follow along?
I'm going to be here in Colorado doing my residency until 2027. Try and enjoy that as much as I can. So I'm always like on weekends, I'm flying to Utah, or I do marathons, like I do races and stuff. The future's bright. There's a lot of good coming up ahead. So you can follow me at ToothDocJack on Instagram.
Thank you so much for hanging out with me this morning. I've really enjoyed chatting with you. I definitely think as you move into your new practice, we should definitely connect again. And I'd love to chat with you more about owning a new practice and maybe like hiring hygienists and assistants and the busyness, because I just know pediatric dentists are so busy. You guys just
Yeah.
like all day. So I'd love to do that if you're ever open to that in the future. Thank you so much for listening, and I'll see you in the next one.